I'm going to kind of go through a little bit about some of the chair and how the chair actually works and functions. One of the first things that I loved about this chair and the simplicity of it was that the chair itself, the patients can sit on it. Most doctors and most PTs have used decompressive type of devices as well as mechanical traction type of devices that will stretch that lower back to achieve the goal that we're trying to reach. The thing I've always had trouble with that in the past with the machines that I've used is you have to, number one, sit the patient down and lay them down on that table, which is difficult for a person that has a lot of back pain itself. With this one, a person just has a seat and lays back, and then the chair itself will lay that patient back into the supine position. So obviously that's very, very comfortable. As you can tell with the chair, all the pieces that are utilized are already here. There's no straps, there's no ropes, there's no pulleys, there's no computer system that's pulling the patient that frankly scares a lot of patients that I've found throughout the years. With this one, it looks like a sofa. People sit down on it and it lays them back and they're very relaxed, and they do very, very well with this as far as not having a bad patient compliance ratio. One of the things that I loved when I looked at this thing the first time, and I really thought was genius in the way that they made this, that no other devices have this at this point in time, is the way that the chair is shaped on the bottom. When a person sits down, that actually rotates the pelvis back into the posterior position, which flattens the lumbar spine, so it actually pulls that lumbar spine back into the position that it's at. Where that's really important when you're doing mechanical traction is then when you actually start that axial traction motion, you then naturally decompress each one of those discs, but the importance of it is you've now realigned it like it's actually supposed to. So instead of pulling on a curved spine, you're pulling on a spine that's already flattened, and you're achieving that goal in a much better way than with the other machines that are out there. A second portion that I love about this one, and this is once again another thing that no other decompression devices or no other mechanical traction devices out there have, is whenever the table goes into the supine position and the patient is on it, not only do you achieve that mechanical traction aspect to take the pressure off of those discs as well as the facet joints and open those neuroforaminal enclosures up, but on top of that, you also get lateral flexion in there. Now, I found that to be really interesting in the fact that I've been able to use this thing as not only a treatment device but also as a diagnostic feature, with the fact that it does create the axial traction and then go into lateral flexion. I've had a few patients where my simple palpation exams as well as my orthopedic and neurologic exams, I didn't find a pinched nerve. However, whenever it went into the lateral flexion, I was able to notice that there was a problem there. So, it even served as a second catch mechanism, which was cool. That's not even what the chair is for. But one of the great things about when it goes into the axial traction as well as lateral flexion mechanism itself is with a hot back, especially with a hot back, with many other things as well, but especially with a hot back, the psoas muscles, which are the pelvic stabilizers for the anterior side of us, and then the quadratus lumborum muscles that are on the back side of us, that are those muscles back there that people can really feel that get tightened up in the back.